Hey guys, it's Paul again from Stretching Canada. Here I'm confined to my studio because the Quebec government has imposed stricter, more strict confinement rules, so we're not allowed to go to the clinic anymore, or can go outside and go and do stuff, but most of the time I spend here, which is not a big deal. I'm here a lot anyway. And I thought I would, in fact, it's good that I'm doing it from here because I want to show you how I work. When I'm working, I'm standing. I almost never sit. I have this really awesome chair that I almost never use unless I'm kind of at the computer or something. But what I do have are little tools to help me for when I'm standing and keep me standing. As I said earlier, I don't have a TV, so I'm not sort of set up to lounge or anything. But I have an iPad and I watch, YouTube channels that teach me how to paint better, teach me how to move my body better, kettlebell workouts or anatomy things and things that keep me up to date with my, my professional work. So here at the studio, or when I'm, even when I'm cooking in the kitchen, I have things that I can put my foot on. And here, let's say I spend a lot of time here. Sometimes I'll just put something down, like a box that's handy, and that's there. And what that does for me is that when I don't have something here, and I do get into these restrictions because I'll stand forever and ever, and I get into some sort of a, that artistic flow, that kind of what would you call that? The influence of just a moment where I can't stop, and I'll find myself getting more and more tired in my low back and tired in my calves, my gastrocs, and that was at the beginning when I first started painting about 3 or 4 years ago, and now I can paint for hours and hours because I have these little tools like you'll see here. This little stepping stool, which I use mostly in the big room where I'm doing the big paintings that are 8 or 9 feet high, so I can kind of get up there and do that. But here, it's usually where it resides, and this is where I do most of my work, so all my tools are here. And I can be really comfortable here and, shift from side to side. And the more comfortable I am, and this applies to me in the clinic as well. The thing is, my table's electric in the clinic, so I can adjust its height rather than my posture. But when I'm here, I don't have an awesome easel. It doesn't go up and down by itself electrically, so I have to either adjust it, or once it's set, I can be really stable here. And the more stable I am, the more accurate I can be with my brush or my pencil, because this just dissolves into horrible postures. Really bad for my own physical posture, my low back issues and history. I have my own things going on too. So I have other things. Here, this is like a nice sort of spongy thing, and I also have this. I think a clean version of this would be under my other desk where I do computer work. I don't know I don't know where I got it, but I bought like a box of them. So there's a bunch of them at the clinic, and there's one here for when I'm standing and drawing, or just going through the motions of trying to figure out how I want to approach somebody, how I want to draw somebody. So I do a lot of it standing, so I have as many little tools as I can. Yeah, that's pretty disgusting. All right. Anyway, I wanted to go back to the stretches that we talked about yesterday, and I had said, well, I'm not a big fan of stretching with elasticy things because most of the stretch is given way to the elastic rather than the surface, rather than something hard, and that you can use pretty much anything. And these are around the clinic all the time because accidents happen and stuff gets spilled, and you want a bunch of these or old towels lying around. And I use them, and when I do stand for too long, and it's like 1 in the morning, I've been painting for 8 hours, and which is not even an exaggeration. That happens a lot. I'll just grab one of these, and I'll do exactly what I'm doing now. Here, maybe I'll move this out to the side so you can see what I'm doing. And just to reiterate, you can use anything you want. In fact, you don't even need to assist it. You can just do this. So I'm contracting, agonist contraction, to send a neurological message to the antagonist or targeted muscle. Feels better already. And then, you know, I'll use my little stretching assistant, or I have this, which I've had for ages and ages, probably 20 years. And I wash it now and again because it gets really disgusting. 1, 2. The only thing is that it's kind of slippery, and if you're doing a lot of work, especially if I'm doing hamstring work, it tends not to be long enough, but also kind of digs into my foot. So back to my handy dandy thing. So the gastrocs. Now I could be, if you're lying supine, so I'm now lying supine. The only difference between this stretch and lying supine is when I'm disengaging the hamstrings from this position and I'm lying supine, I'm going to attract more the belly of the gastrocs than here, where now I'm engaging the hamstrings a little bit. I'm going to get more of the proximal gastrocs. So just for the sake of the demonstration, you know that you can lie supine on your bed, on the couch, or on the floor, on your massage table. And I tend not to do this, but for me it's not much of a stretch when I'm supine, so I'll do it the way I normally do it, which is, 1, 2, and I'm reaching back with the anterior tibialis, and then I'll just 1, 2. I'll add a little bit of an assisted pressure. 1, 2. 1, 2. And then, I'll do both sides. I keep saying the same thing, but I'll do, say, 8 or so on this side, and then I'll do 8 or so on this side. Then I'll come back to this side. But now I can get more specific in the gastrocs by throwing my strap or my towel around one side. I'm still doing exactly the same action, but I'm going to do a little bit of an inversion at the foot. I'm still reaching back equally, or rather assisting equally with both sides of the strap as I come back, but a little bit more equally on the inside. So I'll just reach back and then add a little bit more pressure here. 1, 2. 1, 2. 1, 2. And if it's sticky enough, you can just sort of leave this one alone. Reach back and just assist here. So as I'm contracting more on the interior, the medial aspect of my gastrocs, I'm going to be sending more of a signal to the peroneals or the fibulari. And then of course, conversely, I can evert my foot, and then 1, 2, apply more pressure here. 1, 2, 1, 2. And so of course I'm going to do both sides again, but just right away I feel a lot of difference in my foot, in the leg. I feel a lot more circulation going on. And when I do this, and it is late, and I don't have to be anywhere the next day, and I can paint well into the night, and I'm really in a flow, and I don't want to break that inspirational flow, I'll stop, I'll stretch. I have an AIS mat in the big room. I'll even do, workout with my 12 kilogram kettlebell. Just get into some real movement, whatever doesn't bother neighbors downstairs. So we've done gastroc, medial, lateral, but now, this is actually pretty low. If I disengage the gastrocs by, here, I'm not very well lined up, am I? If I disengage the gastrocs by bending the knee, so now the gastrocs are more or less out of the picture. If I do this, what I'm working on now is really underneath the gastrocs, which is the soleus. And 1, 2, same thing, 1, 2, 1, 2. And if you can't reach around for whatever reason, and there was a time when I was huge and I couldn't reach my foot and I thought it was impossible. I mean, I was huge. You can do this. Nothing wrong with this. Perfect. A lot more grip with this. Oops, sorry. So 1, 2. 1, 2, 1, 2, 1, 2, 1, 2. And then you can also do the inversion and then the eversion. A little harder with this, but it's entirely doable. And one of the things about the soleus that you don't get in the gastrocs is that there's a different muscle around the venous return. The veins have different muscles around them that help pump the blood back up to the heart because it's so far away from the core and heart of the body. So when you get into the stretching of the soleus, it can make a big difference in mental acuity and not just in how you stand, but how your blood is, how you're oxygenating your body. So one of the other things that I wanted to go back to from yesterday is we were talking about the hamstrings, and somebody asked me about the stretching of the semimembranosus tendinosus, or the semis, and the bicep. And what I do for that is I can be quite specific to those semis. So if I'm lying supine again, and I do this sitting, you'll often see me at airports doing this, not with the strap sometimes, but just doing this and this, because, when you're in layovers and you've been sitting in an airplane chair for too long, it can be really uncomfortable. And this is one of the things that I find the easiest to do. So anyway, back to the semis and bicep of the hamstrings. This is the action we were doing, the distal portion of the hamstrings. So this is kind of bilateral, working both sides at the same time. Now, if I internally rotate the tibia, I'm actually using the semis to rotate the tibia. I'll wrap my strap or my tea towel on the inside so that as I'm assisting, my assisted pressure helps maintain that internal rotation. And then 1, 2, I'm still stabilizing with my other hand, 1, 2. And now I'm really stretching the bicep, 1, 2. And then conversely, this is a little harder because the further up you go while stretching the semis, the more the thigh wants to rotate. So I really got to grip my thigh. 1, 2, 1, 2. And again, I'm just using that same kind of pressure. Work both sides. So I wanted to throw that specificity in for the distal hamstrings from yesterday. I'm just sort of seeing here this. I got distracted for a second because this I use all the time. It resides right here, like all my other stuff, my little toys. And I do this sitting down because I do have a little bit more control, I find, maybe not that low, but rather than from when I'm standing, I'll work through the heel from proximal heel. This really helps open up the muscles of the feet as they pertain to the ankles. And then through the anterior heel. Then I'll do the metatarsal heads. Oh, I haven't done it for a couple of days and I really feel it. Ouch. I'm trying not to apply too much pressure, and then I'll do the first metatarsal, second and third, kind of hard to get one or the other, but second and third, third and fourth, fourth and fifth. And then when I've done that, I'll go from posterior to anterior along the first ray, first and second ray, second and third, fourth and fifth. Kind of seems pretty necessary today. Ooh. It actually feels really good. I'm making faces, but it feels really good. And then I'll do both feet, and then I'll wash it because it can get pretty disgusting. So that's it. These are all the things that I do for myself, either here in the studio or in the clinic. Whether I do as much as I can. I have had back issues in the past from being severely overweight to just being lazy and not really taking care of myself. But now I do take care of myself, and now I do have all the tools around me, and I do take courses, and I do listen to other people that issue solid information. And one of them was to stand as often as possible. So you might see me in my videos or when I'm filming, how I paint. I'm always standing. I'm never sitting. The only time I ever sit is really like to eat, and most of the time I spend on my feet. So if you can get yourself little platforms like this. Where was I? Oh, all these people watching. Hi. Hi, Karen, Ryan, Mirella. Hello. Jason, Greg. Hey. Yeah, so I'm taking care of myself as much as I can to be as solid on the ground as I can. And, displacing the weight of my hips when I'm standing a lot. And in fact, I do have one of these now that I think about it at the clinic. When I'm sort of spending a lot of time in one place, And that's something else. I said I have one of these at the clinic, and I do. It's a better one, a wider one. It's a more solid one, so I can sort of sit and stand at the same time. Because it'll do a lot of cranial work. And if I'm on a chair, I tend to sort of find myself really having a hard time finding my balance in a chair. And these, you know, you just don't, these sort of kind of lovely, expensive chairs, just too limited. And a ball is too hard to find a place to put it, and, you know, sort of wanders around, and I finally just put it away, or threw it away, or something. But with these, you know, I find that these are really helpful for the back, because then you can sort of move around, but you're still stable on the ground. Hey there. Well, what'd you say? I'm a bit worried that our knees are... I do have suggestions. Can you text me, Karen Bowden? Can you text me, and I'll definitely answer that question. So anyway, I'm sort of winding this down because I'm starting to repeat myself, because I really believe this stuff is helpful for me. And tomorrow, you know, we can go into the toes. There's issues I'm having with my like a thoracic outlet thing. I know it's from doing this more in the last week, and it's also coming from the neck. So I'm going to address that for myself, but I also want to be able to help you guys too. So like Karen was asking, is there some way we can resolve certain issues? There's lots of ways I can help. Stretch the active isolated stretching isn't always an answer. It's an awesome tool. But I need to have history and find out where I'm going to stretch, but why I need to stretch that. And if I find that there's another place that's the problem, I'm going to go towards that rather than working on the site of the pain. I'd like to find the source of the pain. So while yes, I could probably help you with the specific issues, even by Skype or live, I'd rather get some sort of a history and work together with you. So. Again, if you have questions, you have suggestions, please give me a shout, and we'll go from there. So I hope you guys are safe, and I hope you guys are comfortable, and that you know, we got to play by these rules. It sucks, but hey, you know, I got a good feeling that we'll get through this, and there's lots of positive things we can do, and I hope that this is helpful for you. Okay, guys, peace out. Have a good day.